Hi, I'm Bernardo, and I'm an early stage researcher at HealthPros, and I will try to share what we worked on for the last 3 years. So first, I want to remind you that it is likely you know someone with type 2 diabetes. So are you aware that 6% of people with type 2 diabetes will develop a food ulcer in their lifetime? And over 60% of people with a diabetic foot ulcer will die or suffer a leg amputation within 5 years of their first foot ulcer. So the problem is that few research has been conducted on how to improve these patients' health through organizational interventions. In part, this is because conventional prospective research study designs can be very costly and may take a long time to be conducted. So HealthPros tackles this problem by enabling scientific research using routinely collected data from the electronic health records in European registries. In other words, that is information captured every time one visits a doctor. And we use this data to conduct retrospective cohort studies to compare how organizational factors of health systems impact on the outcomes of people with diabetes and food complications. So, for example, during this PhD, we conducted 2 retrospective cohort studies in England and Scotland. And we found that receiving bundles of primary care services within 6 months prior to a foot ulcer reduces the risk of suffering a leg amputation or dying. And this effect being larger in people over 70 years of age. So these findings are useful to orient future research. Prospective study designs could then be more easily conducted if targeted on specific populations. And to achieve this, HealthPros is training future experts on translating the existing data intelligence into actionable health policy. In this specific PhD, for example, this meant training 3 skills: data management skills, epistats, and understanding the care gap in a specific clinical domain from relevant perspectives, including the biomedical, ethical, and epidemiological perspectives. So we would like to invite you to continue talking on how we can expand this research across other chronic conditions and across other European countries so as to enable international comparisons. So thank you for joining, and do follow the links if you'd like to learn more about HealthPros.